A wide range of research information is available to healthcare professionals, and it can be a challenge to keep up to date with all available data. Systematic literature reviews respond to this by bringing together data from multiple sources and presenting it in a clear and accessible format. All systematic literature reviews should begin with a clearly defined question. The aim is to answer this question by identifying, appraising, and summarizing all the available relevant evidence. A literature review is a general term used to describe the approach for identifying data from different empirical studies. In particular, researchers use a systematic literature review to answer a specific question. It involves conducting a comprehensive search to identify relevant studies, appraising the quality of the data reported in those studies, and narratively summarizing the findings from the studies identified. A meta-analysis may then be conducted to pool the results of two or more of the studies identified by the literature review in order to create a quantitative summary of their combined findings. The quality of clinical evidence is often ranked by study design, with well-conducted randomized controlled trials generally considered to provide the most robust evidence. However, results may vary between clinical trials, and trial data may not answer all questions. Therefore, systematic literature reviews or meta-analyses can be conducted to increase confidence in the clinical finding where more than one trial exists. In addition, a meta-analysis may answer questions that either could not or were not addressed in individual trials. For example, the comparison of a new intervention against one or more comparators where no head-to-head trial data exist. Systematic literature reviews have three key stages: planning, searching, and reporting. In the planning stage, the research question is defined in the protocol development, which describes how the literature review will be conducted. The next stage is the searching, where all relevant articles are identified according to an explicit pre-specified search strategy. The studies are then selected according to the predefined inclusion and exclusion criteria, their data extracted, and the quality of their design and reporting. The final stage is the reporting, where the results of the review are discussed. At this stage, a meta-analysis could be carried out, provided it is appropriate to quantitatively combine the data. We will look at each of these stages in turn and consider what constitutes good practice when carrying out a systematic literature review. Firstly, let's focus on the planning stage. Before starting a systematic literature review, it is necessary to define a clear, focused question to be answered. When constructing the question, it is useful to consider the population to be examined, the experimental intervention to be evaluated, the comparator interventions, and the outcomes against which the experimental intervention and comparator interventions will be measured. These four factors are known as the PICO framework. It is not always necessary for the research question to address all four factors. For example, consider a systematic literature review examining the clinical efficacy of biologic disease-modifying antirheumatic drug treatment in adult rheumatoid arthritis patients. This may only consider three of the PICO factors: population, intervention, and outcomes. Once the clinical question has been constructed, the next step is to plan the review's methodology, which is documented in a protocol. A pre-specified protocol is essential when conducting a systematic literature review. This aims to reduce the risk of bias and helps ensure that the results of the review accurately reflect the published literature. Having established the clinical question being addressed, the search strategy should be defined. For example, which search terms to use and what databases to search. The criteria for study selection and assessment should also be defined and the data extraction strategy finalized. The format of data synthesis should be decided and a timeline for the project put in place. Once the planning is complete, the searching can be carried out. There are two important factors to be considered when designing the search strategy: the sensitivity and specificity of the search. Sensitivity is defined as the proportion of all the existing literature on the research topic that the search will retrieve. Increasing the sensitivity will make the search more comprehensive, but increase the chance of returning articles not relevant to the research question. The specificity of the search refers to the number of studies, relevant to the research question, that are retrieved by the search. Increasing the specificity will reduce the number of non-relevant studies retrieved by the search, but could lead to relevant articles being missed. There is therefore a trade-off to be made between sensitivity and specificity in order to strike a balance between comprehensiveness and precision. The search terms used for a systematic search should combine both medical subject headings and free text and must consider synonyms, acronyms, abbreviations, spelling, terminology, and different names for the same interventions. Searches may be limited to only identify articles of particular study designs, those published after a certain date, or in a certain language. The search terms will include those relevant for each PICO factor being considered. However, searching with each term on its own is likely to return far too many articles for review and lack specificity. For this reason, the search concepts are often combined using the Boolean operators and, or, and not. This ensures that only potentially relevant studies are identified and should reduce the volume of articles to a more manageable number. It is important to search multiple sources as no single resource will contain all publications on a particular topic. The electronic databases chosen will depend on the research question. The three main resources for published clinical trial data are Medline, Embase, and Central. These should always be searched together with additional resources, if appropriate. Additional subject-specific databases can also be searched if required. The decision whether to search these should be based on the research question. Once the search has been completed, the next step is to evaluate the studies returned and decide from which ones to extract the data. It is good practice for two people to independently conduct study selection in parallel to minimize the introduction of bias. First, citations are obtained and any duplicates removed. The titles and abstracts of unique citations are then assessed using the predefined study eligibility criteria, and non-relevant articles are excluded, usually with a reason for exclusion. The full texts of all potentially relevant articles are then retrieved and examined, and the final decision on study inclusion is taken based on the predefined eligibility criteria. The reasons for excluding studies are also documented at this step. If there are disagreements either at the title, at abstract, or at full text evaluation stages, they can be resolved by a third person or through discussions. At this point, any additional studies from the reference lists of included articles should be retrieved and undergo the same study selection process. This is done to ensure that no studies were missed during the search process and acts as a good check of how effective the search strategy is. Once the relevant studies have been identified, the data of interest should be extracted. Again, it is good practice for the data extraction to be performed independently by two people in parallel, to minimize the introduction of errors and bias. In other cases, one person could extract, and a second, more experienced person could check the extracted data for accuracy and correctness. If there are disagreements between the two people involved in the data extraction, these can be resolved through discussions. Tailor-made data extraction forms that ensure that all data needed to address the research are captured should be used. These can be either electronic, using spreadsheet software, or hard copy. The most important points from each study should be extracted, including details of design and key results. Once the studies for inclusion have been identified and data have been extracted, the quality of the methodology and reporting of these studies should be assessed. This appraisal is often conducted using a risk of bias assessment tool, which aims to evaluate if a study is done well and if there are any mistakes or biases that could affect the results. It helps researchers figure out if they can trust the study's findings by looking at things like how the study was conducted, how the data were analyzed, and if there are any errors or problems with the reporting of the data. This allows the reviewer to draw their conclusions based on the best quality data. Various guidelines exist to help rank the quality of studies based on their design. However, due to study variation, subjective judgments often need to be made regarding the quality of data. The final stage of a review is to report the results. Reporting should follow the preferred reporting items for systematic reviews and meta-analyses guidance. A Prisma flow diagram visually summarizes the results of the screening process. A Prisma checklist can be used to validate that the systematic literature review report contains all relevant information. The data extracted from the included studies should be reported systematically so that the main features of each study and its findings are clearly presented in a table with accompanying text, where possible. Results can also be presented graphically, for example as bar charts comparing values across numerous studies. In addition to systematic data extraction, a descriptive summary of the findings of the review should be written. This should include a brief overview of the main results and findings, a discussion of the applicability and quality of the evidence, an outline of the potential biases in the review process, and also the context and plausibility of the findings. At this point, the judgment can be made as to whether the data are suitable for a meta-analysis or indirect treatment comparison. Meta-analyses use statistical methods to combine data from two or more studies, taking into account study heterogeneity. This increases confidence in the result by analyzing all available data. Additionally, conducting a meta-analysis may allow a comparison of interventions where no head-to-head trial data exist. In principle, every systematic literature review could result in a meta-analysis or indirect treatment comparison. However, in practice, such analyses should only be conducted if the data are consistent across studies. This is when they have comparable populations, interventions, and reporting of clinical data. In this video, we have covered what systematic reviews are and their three key stages, the importance of having a focused research question and a predefined protocol, along with how data should be extracted and reported.